Hey everybody, today I want to talk about what the APTA needs to do for us to make us more money. So in order to do this, I first want to briefly review the strategic framework for 2030 for physical therapy. So looking at the APTA's strategic framework for 2030, I want to scroll down and look right at the advancing our payment. So let's take a quick look at this. So we plan on increasing payment by 10% for the 5 codes most commonly used by physical therapists and increasing payment by 15% for evaluation codes used by physical therapists. Okay, that's a great start. I especially like the 15% increase for evaluation codes because I do think we need to be doing more skilled evaluation. Yeah. So then creating 30 new tools, events, and resources to support at least 30,000 members with the aim of increasing payment, reducing administrative burden, and elevating the role of value of PTs and PTAs in the healthcare landscape. Facilitate networking and discussion amongst at least 5,000 members about advancing payment at the state and local level through a new APTA online community focused on the State Payer Advocacy Resource Consortium. So I agree. I think it's very important that we all get together and try to solve all of our problems together. There's definitely power in numbers, so good idea. Increase the number of PTs participating in alternative payment models by 15%. Equip 30,000 PTs to understand and engage in value-based care models through dynamic educational resources. Demonstrate the impact of value-based care models through the collection and dissemination of outcome data through 3 reports. So yeah, I'd like to hear a little bit more about this alternative payment model. I assuming it's like they state, it's based more on value-based treatments and such. So more quality and less quantity. So I'm on board with that for sure. But I would like to get a little bit more information on exactly what that is. Increase the utilization of PT, PTA teams across the profession by 15% to improve patient access to physical therapy, especially in rural and underserved areas. Reduce the use and application of multiple procedural payment reduction policies by federal and commercial payers. Achieve general supervision and standardized supervision ratios in state regulations and payer policies. Improve access to care through reduced wait times and better patient to provider ratios using PT, PTA collaboration. That sounds like it's great for the population, but in terms of that helping us, that doesn't really help us make more money. It helps the PTA demographic definitely more, but doesn't really help us to increase our payments for PT. Achieve direct access for Medicare patients by eliminating the plan of care certification requirement by 2030. Advance at least 5 federal policies to ease administrative burdens and expand practice freedoms for physical therapists serving Medicare beneficiaries. Improve access to care and lower costs by enacting 50 state-based policies to reduce administrative burden in collaboration with state chapters by 2030. So yeah, that's definitely a good thing. Trying to reduce our burden and having to rely on physicians to sign our plan of treatments is definitely a benefit. And then I just want to scroll down for evolving our practice. This was something that was very impactful to me. Advance 15 evidence informed career pathway transitions by 2030, helping members navigate new opportunities and advance their professional growth. Establish strategic partnerships with technology providers to co-develop telehealth and digital delivery tools, giving members access to innovative solutions that enhance patient care and practice efficiency. I think that's awesome. I think the idea that we can potentially work remotely and help more of our patients online is a great thing. Obtain expanded authorities such as diagnostic testing, lab ordering, and limited prescription privileges in 15 states, enabling members to deliver more comprehensive care and improve patient outcomes. I think that's a good start, and I like that they're actually listing some specific things that they're working on. I would like a little bit more specifics on that. But I want to go into the 3 major areas where I think the APTA really needs to help our profession and help us make more money. So area number 1, we need to be able to give injections to patients. We need to be able to give cortisone injections, trigger point injections, and as regenerative medicine comes about and evolves, we need to be able to give, PRP injections and injections that can help regenerate tissue to help with healing. That would be a big thing for us. Area number 2, and they already touched on this, is being able to readily prescribe medications and also order diagnostic imaging and interpret it more regularly. I think that's a big part. And aside from being a physical therapist and a clinician, a lot of us after 5 or 10 years are going to work our way out of the profession. Sad but true. And if you look at non-clinical roles, A lot of them in the healthcare industry revolve around pharmaceuticals. So I can't tell you how many jobs I've looked at where you see they're looking for healthcare workers with experience. And who are they looking for? You guessed it. Nurses, physician assistants, nurse practitioners, doctors, pharmacists. Physical therapists are almost always left out of that list. And why? Because our education and our profession doesn't revolve enough around medications. So we need to evolve the education system around the DPT, and we need to include more education on medications, not just for the clinical purpose, but also if you decide to work out a physical therapy, this will help raise that ceiling and give us more opportunities. And then number three for areas for how the APTA can give us more money. So we all saw that in late 2025, physical therapy is no longer recognized as a professional degree. Well, that's going backwards. Because in my mind, we need to be able to give a medical diagnosis for things. Right now, physical therapy diagnosis, what is that? Isn't that almost like giving a set of toy keys to a child to make them think that they're driving a car? That's honestly how a physical therapy diagnosis, that's the analogy I'll draw for it. So we need to be able to give that medical diagnosis, especially as it pertains to outpatient orthopedics, probably more so than those other subspecialties. But research has shown, compared to a primary care physician, we're much more accurate. If you're a specialist compared to an orthopedist, if you're an orthopedic clinical specialist, you're just as reliable as they are providing a medical diagnosis. So those are the three main areas. Is the strategic framework for 2030, is that optimal? It's definitely a good start, but is it going to justify the continuing high cost of education versus what we get paid? That's iffy. I think it's always important to be involved with the APTA and just kind of look at the director board because these are elected officials. And the person who I'm going to vote for is the person who's going to address those three main areas. So I hope you like this video. I hope it resonates with you. If you do like it, please share it with other physical therapists. We really need to get the word out and we need to all work together. There's a strength in numbers on this. So I hope you like this video and I'll see you in the next one.